right, here is the scan of the room. All right. Alrighty. And my name is Kristen Swanson. I'm going to be doing a cardiac and PVS exam on you today. I'm going to start by looking at your jugular venous impulses. So I am going to step behind you. I want you to have you turn your head slightly to the right for me. And I'm just going to shine the light on your neck here. I'm looking for your pulses there. Good. And then I'm going to come to the other side. I want you to turn your head slightly to the left. Good. I don't see any abnormal pulsations in either side here. And now I'm going to check for the point of maximal impulse here, which is about the fourth intercostal space, about mid-clavicular line here, or fifth. I'm just going to use one finger and palpate while I'm here. Really any abnormal pulses there. And again, I'm just going to shine a light, and I'm just going to watch for that pulse. Good. No abnormal pulses there. And then I'm going to check your carotid arteries. I'm going to check one at a time. So I just want you to stay there. And I'm just going to push here. Good. And on this side. Good. I don't feel any thrills with that. And then I'm going to identify the angle of Louis, which is you start at your sternal notch here, and then you move your fingers down to where the manubrium brings the body to the sternum here, which is about here. And then I'm going to go up a little over to the right here, and I'm going to check your aortic area. Just going to feel for any pulsations here. And then I'm going to move to the left and do the same thing. Feel for that pulmonary area. And then I'm going to move down to the fourth intercostal space here. Check for your tricuspid. All right, and then I'm going to move to the fifth intercostal, mid-clavicular here, and checking for that mitral. Good. I don't feel any abnormal pulses or masses or abnormalities in those areas. So now I'm going to listen to you. Again, just kind of sit there and hang out. I'm going to start with listening by the diaphragm. And my stethoscope does not have the switch to move to the bell, but I have a little button here that switches from my diaphragm to my bell. So then I will repeat the area switching to that. Again, I'm going to start over here at the aortic. I'm going to switch over to the bell and listen all over again. Okay. I don't hear any abnormal murmurs or S3, S4 sounds or any clicks or rubs. While I have it on the bell though, I am going to go ahead and listen to your carotids to see if I hear any brills either. fluids or thrills there. Your rhythm was actually low, so my stethoscope also has the ability to tell me your heart rate, which was about 55, 57. So it's a little bradycardia, but the rhythm was normal, and again, no murmurs or palpitations that I could hear. So then what I'm going to have you do is I'm going to have you roll to your left side. I'm going to move these pillows out of the way. I want you to have your left hand behind your head and your right hand alongside of your side here. And I'm just going to lean across to you here, and I'm just going to listen back to that tricuspid and mitral area of your heart, okay? So lean a little bit just further back here. Go switch back to the diaphragm here. Good. Still don't hear any abnormalities there. I'll go ahead and have you sit up on the edge of the couch, please. All right. What I'm going to do is I'm just going to assess the upper part of your body. I'm looking at your shoulders. I'm going to start at your shoulders, work my way down. I'm looking for symmetry, color, distribution, temperature, veins, all those things. So first of all, I can know that you are not symmetrical. There's a little right asymmetry, but that's with a known history of multiple surgeries. So then I'm going to, otherwise your color is even. I'm going to just have you rotate your arm out for me as best you can. I'm just going to check that brachial pulse here. Good. 3+ there. Good. And then I'm also going to feel about a couple centimeters up here that you have that epitrochlear lymph node. I don't see any swelling on that side. Same on this. No swelling there. I'm going to check your radial pulses and check those bilaterally while I got you here. Good. 3 pulses there on both sides. Go ahead and flip your hands over for me. Good. Capillary refill is less than 3 seconds, which is good and normal. And temperature from your hands on both sides are all equal and even. Alrighty, and then I'm going to have you stand. Actually, I lied. I'm going to do one more test. It's an Allen test. I'm going to hold both your radial and your ulnar arteries, and I want you to make a fist. And when I tell you to release the fist, I'm going to release one of your arteries, and I just want to check the coloration of your arm. So go ahead and make a fist for me. Okay, and then release. Okay, and make a fist. Okay, and release. Okay, I'm just checking to make sure that the blood flow comes back to both of your hands after each radial and ulnar is released. Okay, go ahead and make a fist on this side. And release. Good, and make a fist. And release. Good. All right, so now I'm going to check the lower half of you, so I'm going to have you stand up. Also didn't notice any swelling in his arms or at all. Go ahead and just face normal. Looking at his legs and thighs, legs look symmetrical. The hair growth is equal between his thighs and calves and toes. Go ahead and turn around. I don't see anything there, all the way around. All right, so on the back side here, just because I do know that there is a birthmark over here on the left posterior thigh, and some varicose veins down the right and left leg. All right, so you can go ahead and have a seat back on the couch, and I'll actually have you lay completely down for me. Alrighty, I'm going to check your inguinal lymph nodes. For the sake of the video, we're going to leave clothes on, so I'm just going to feel. I don't feel any swollen lymph nodes. I'm going to check the carotid arteries, the femoral arteries. Good, 3+ pulses there. And now I'm just going to check pinch your legs for any pitting edema. I don't see anything there. None of the meatus, and then no pitting edema in the shins. Toe color is again pink. Nail bed color is pink. Cap refill is less than 3 seconds, which is great and normal. I'm gonna do one other test. I'm gonna have you lift your legs up for me, all the way up. Yep, put your legs back down. That's as close to 60-degree angle as I can get. I'm just gonna check the temperature of your feet and legs. Good, neutral that way. So what this test does, we keep your legs above 60 degrees, or about 60-degree angle for about a minute until the color starts to drain from your feet. And then once it hits about a minute, for the sake of the video, I'll go ahead and have you switch your feet down for me. Go ahead and sit on the edge of the bed, or on the edge of the couch. And within 10 to 15 seconds, that color should return to your feet, which it looks like it has. All right, that's all. Thank you.